Today's video topic is hip labral tear. The head of the femur is shaped like a ball and fits into the socket of your pelvis. The labrum is a ring of cartilage at the edge of this socket. It gives stability to the hip joint and also absorbs shock. A tear in this cartilage is known as a labral tear. It causes pain, instability, and a clicking sound when moving your hips. Hip labral tears are most common in athletes that play contact sports like football and hockey. Also, structural differences in the hip can make some people more likely to have the injury. Types of hip labral tears. Labral tears are classified into two based on where the labrum is torn. Anterior tears occur on the side of the joint closer to the belly, while posterior tears occur on the side of the joint closest to the back. The majority of tears occur on the anterior side, which is thinner and wider than the posterior. Symptoms of a hip labral tear. If the labral tear is small, it doesn't cause any symptom. When the symptom develops, they tend to overlap with other hip conditions like hip bursitis or hip flexor tendinitis. Symptoms can include pain when rotating your hip, pain at the front of your hip near the groin, dull pain that worsens after activities like running, walking, or prolonged sitting, pain that extends into your buttocks or toward your knee, clicking or locking at the hip, stiffness in your hips when moving. You should seek medical attention if the pain is getting worse or affecting your daily activities. How does a hip labral tear occur? It can be caused by a sudden traumatic injury or repetitive wear and tear on the hip joint. The most common underlying cause of this condition is impingement of the hip bones. Impingement happens when the head of your femur pinches the socket of your hip bone, causing repetitive contact between the pelvis and femur. Other conditions that can make you experience labral tears include joint degradation, osteoarthritis of the hip, instability of hip joint. How is a hip labral tear diagnosed? Diagnosis of labral tears is usually difficult because many hip injuries cause similar symptoms. They are often misdiagnosed for groin strains. Your doctor will perform a physical exam and consider your symptoms. They may put the hip in certain positions to know if you are experiencing clicking or pain. How is a hip labral tear treated? Treatment isn't needed if you don't have any symptoms. However, if you are experiencing pain or discomfort, your doctor will recommend non-surgical treatment first. Then, if there is no improvement, you may need to perform surgery. Home management. You can manage your symptoms at home by avoiding activities that cause pain, getting plenty of rest, taking non-steroidal, anti-inflammatory drugs to manage pain and inflammation. Physical therapy. This helps you return to your normal activity without pain. It also helps correct movement patterns, minimize pain, recover your range of motion, return to sports activity, and strengthen your thigh, buttocks, and back. Surgery. If you have a severe tear or your tear doesn't respond to treatment, you may need surgery known as arthroscopy. It is performed by using a narrow tube with a camera and light.
Thank you for watching our video. Please do not forget to like and share the video. Also, please subscribe to the channel to stay updated on our latest videos.